Well, hi there. My name is Jason Flatt, and I use pronouns he, him, they, and them. And I'm an assistant professor. I'm at the University of Nevada, Las Vegas, in their School of Public Health, and I'm in the Department of Social and Behavioral Health. And much of my research has been focused on Alzheimer's disease and related dementias and experiences for the LGBTQ plus community. And that's lesbian, gay, bisexual, transgender, queer, as well as people that may use a different term, but they don't identify as heterosexual or cisgender, which represents people that do not identify as transgender. So I'm really excited to talk with you today. Well, I wanted to start off with giving you a little background on the terminology that I would be talking about in terms of LGBTQ plus or sexual and gender minorities. So sexual minority, this represents individuals who would self-identify as asexual, bisexual, gay, lesbian, queer, or they might use a term that's different in terms of they self-identify with another term, but their sexual orientation varies from identifying as heterosexual. The other term that I'm using is gender minority, or this represents individuals who may self-identify as transgender, non-binary, or they use a term for their gender identity or expression, and it shows that it does not align with sort of the social and cultural expectations that are set based on a person's sex assigned at birth. So it also includes people that may identify as intersex. These are individuals that are born with differences in their reproductive development as well as their sexual anatomy. And so this is a group that also we use the term differences of sex development. The other term to know is cisgender, and this represents people who do not identify as transgender, so their gender identity typically aligns with the sex that was assigned to them at birth. It's really important as researchers and in the work, if we're going to advance knowledge to understand health disparities, but also experiences of people as they age and are living with Alzheimer's disease, that we ask about sexual orientation and gender identity. This is especially important because we know that sexual orientation and gender identity, it can evolve over the lifespan. So it would be important that we ask this so that we can understand unique experiences, but this can also be helpful to make your environment more welcoming and inclusive to all people, especially those who may be a sexual or gender minority.